Good evening, everybody. My name is Santana Bingham. I'm a junior here at the University of Memphis in Jackson, Tennessee, and I will be talking about the Children's Health Insurance Program in the Pro Side. The issue that would eventually bring forth the Children's Health Insurance Program is that children in the 1980s had as much health insurance coverage as the average working age adult in the same period. Under the Reagan administration, steps were taken to ensure more children by expanding coverage through programs such as Medicaid. Even though studies show that children had been steadily gaining coverage, since 2016, there's been a growing loss of coverage for people under the age of 18. A problem that has various contributing factors such as the COVID-19 pandemic, changing economic statuses, and a shifting job market. This issue should not be taken lightly, as children's health should be a number one priority for everyone to ensure the future of our country. So a little bit of history about the CHIP program, or the Children's Health Insurance Program, is that it was created in 1997 to expand health insurance to more children than ever before. It was intended for people who make too much money to receive Medicaid but cannot afford private insurance. The program would ensure that they remain covered, and in some states, the program would also ensure pregnant women that they receive coverage as well. So who funds this program? So the first one is the U.S. Department of Health and Human Services. That would be the first one, and then the second is the U.S. federal government. So those are our two sources of funding for this program. So who benefits from it? So children under the age of 18 would benefit from this program, as well as pregnant women in some states, the elderly, and people with disabilities. So a little bit more history about it and how it works is that the CHIP program works by providing low-cost health coverage to select populations who cannot afford private health insurance. Through this program, families can access needed medical services without receiving costly hospital bills. This program helps low-income families who struggle to afford health care for their children by increasing access to health care. The CHIP program guarantees that children receive access to preventative health care. So a little bit more history about it is that prior to the implementation of this program, many children in the United States lacked health insurance coverage. A push for a healthcare system reform would occur in 1990. And by 1997, Bill Clinton would sign the Balanced Budget Act that would include the CHIP program. At the beginning, states were given control over their individual children's health insurance programs, and by 1998, the first programs would be implemented. And as many as 8 million people are currently enrolled in these programs. So a couple arguments in favor of the CHIP program is that children under the program have significantly benefited from the increased medical coverage. There are over 8 million people currently on the system or on the program, which shows that it is a success in ensuring those who are underinsured. Another argument in favor of the Children's Health Insurance Program is that it encourages preventative checkups. This, in the long run, will contribute to lower healthcare system strain and costs by keeping children and other vulnerable populations healthier for longer. And a quick rebuttal about the arguments arguments against CHIP. And I did not have a partner, so I looked through all the arguments and I looked those up and did my own research on why the CHIP program is not efficient. The first one I came up with was that people receiving CHIP will be less likely to go and receive a job that will pay enough to get off the program. In other words, they will underachieve to stay on the program. Another argument is that against CHIP is that some people may see the program as a way for the government to gain control over the states, or a way to overreach. This is a major issue specifically for the Republican Party, as they favor more control being given to the states rather than to the government, while the Liberal Party favors the government inclusion. I personally do not believe in these arguments against CHIP. I think they're kind of shallow, thinking that people will not want to get off the CHIP program because they won't want to find a job because they're on the CHIP project or program. I do not personally believe that is something that can really be considered. We live in America where we have the freedom to do certain things, and I do not believe dismantling the CHIP program in order to discourage people from living off of the government is a wise idea. as so many people are benefiting from this program. And then the argument about CHIP being an overreach on the government's part can be partly true, but at the same time, these uninsured people or the people with disabilities who need the government assistance, it benefits them most. So I do not believe it should be a political argument, but into today's world, it has become a controversial debate. A little bit of an evaluation over this policy. I believe the CHIP program has been successful as it has expanded medical coverage for many more people than it has before. Before the program, the percentage of children who were uninsured was as high as the working age population. Since the Children's Health Insurance Program's creation in 1997, 8 million people have been enrolled into the program. I believe the program is a good start, but requires constant maintenance to ensure it's serving the population it's intending to serve. The issue of funding is a crucial one to be aware of as well, as the program is funded by the state and by the U.S. government. It's subject to budget cuts that may limit its availability to the populations that may need it most. And then some quick recommendations about this policy. I believe the program should remain intact for as long as it's sustainable. I would like to see the program expanded in the future, but we must be mindful of where the money is coming from. And since the COVID-19 pandemic, it's been more important than ever that the Children's Health Insurance Program remains intact and operational so that families are not burdened by sickness and the following debt of hospital bills. So again, I'm in favor of the Children's Health Insurance Program because I believe it helps a lot of underserved and underprivileged people receive coverage and the help that they need in order to maintain a healthy life. Well, thank you.